Okay, so it's 7:30. We're going to start. I'm going to introduce myself. My name is Holly Farbo. I am the Academic and Industry Relations Manager for Hygiene at Aspen Dental. I am a hygienist. I've been a hygienist for 21 years. I was an Aspen hygienist in an office in Pennsylvania for a year before I went into the academic team. That's a little bit about myself. So as I go through this, I'm going to introduce Chelsea to you and have her introduce herself and tell you a little bit about her. You'll see me looking off to the side. We have questions that people have asked ahead of time that we can talk about. And if anyone has questions, there is a question and answer button that you can ask questions and we can answer those live for you. Okay, Chelsea, you want to go ahead and introduce yourself and tell us a little bit about yourself?
Sure. I'm Chelsea. I am a 2016 graduate from West Liberty University. I've been working at Aspen in the St. Clairsville, Ohio office since I graduated in 2016. So coming up, it'll be about 4 years. Yeah.
Okay, great. So let's start off with a question that most people ask, and that is, what exactly is a DSO? What does that mean?
So it just means dental service organization. So basically when you think of that, you think of, at least I think of corporate dentistry, and you hear a lot about that too. So like Aspen, there's over, hundreds of Aspens out there. So very supportive of the like dental services.
Okay. So why did you choose Aspen and not another DSO?
Well, I did have some interviews at other places that I was not a fan of, to be honest with you, just because I didn't get good vibes from them. And what I can say, since I've never actually worked in one, I don't really know how other offices run per se, but I do like Aspen because it's pretty unified. No matter what Aspen office that you go to, it's pretty much the same structure. So you don't have to worry about, if I go to this office and not my home office, if anything's going to be different. Of course, it varies by doctor preferences, but pretty much it's the same way all the way around, same system, same flow of things. So.
Okay, perfect. So a lot of times we talk about our culture at Aspen Dental. Can you talk a little bit about what the culture is at Aspen and what that means?
Yeah, at least what I think it means is that, we're doing things for the benefit of the patient. I enjoy coming to work. It's like we're a little family. You see them more than most of the time you see your family. So when we come there, you enjoy yourself, you enjoy your time going to work, but really what we're focusing on is patient care. And that's our number one thing. So we're all in it together. We all try to make the experience for each patient the best that it can be. And they say, treat every patient like your mother. So, it's kind of a good feeling.
Exactly. One of the biggest questions we get is, do you have quotas that you have to meet?
I wouldn't say quotas, but we do have a budget that we should be obtaining every month. So it's not that, you have this much product that you need to sell. It's basically like, what can I do for the patient? And how can I benefit them? How can I educate them on what can make their oral health better? But not necessarily quotas, no.
Okay. And do you work on commission?
Don't work on commission, but there are incentive plans. So whenever you produce, you can get some incentive for that. But not necessarily, if you do this, how much, like give patients so many products or do services that you will benefit this amount from, no.
Okay. So following up on that question, what types of products do you usually recommend to your patients?
Typically in my office, chlorhexidine or stannous fluoride. MI paste for all patients for the dry mouth, not necessarily even, if they have sensitivity. Dry mouth drill is another one. And then Oral-B electric toothbrush are the main ones.
Okay, great. Yeah, perfect. Okay, so do you have to sell to your patients?
You don't necessarily have to sell, basically just educating them on why these products would be beneficial to them in each way.
Okay, perfect. One other question, this kind of follows in that line. Do you have to clock out or go home if you don't have a patient?
No, you don't have to clock out or go home. Sometimes if there is nothing going on, like there's no patients, you still have other patients that you need to be seen, as far as new patients, or if there's anybody in the doctor's schedule that may need some treatment or may need an oral cancer screening or anything like that, you can, go do other things, maximize your time there.
Perfect. So a question that was asked is, what is a typical day like for you? How does that look?
So basically, when you come in, set up the operatory for your first patient, manage your schedule first, and then obviously in between, you have your new patients. So going in, treatment planning them, doing your perio charts, explaining their treatment. When you're finished with them, can go back to your patient in your chair and kind of go with the flow that day. Say it's a slow day, and you don't really have many of your patients in the chair. You can always help the dental assistants by taking new patient radiographs, sterilization, anything in between. And then when it's really, really dead and say you don't have a new patient, showing up, you can always do your reports and kind of go through it like that.
Okay. So how many hygienists do you usually have in an office?
Typically 2.
2 hygienists. Okay. And so you have a lead hygienist and an associate hygienist.
Mm-hmm.
Can you tell me a little bit about the difference in those roles?
So in the office that I worked for, I was the lead and I had my associate as well. So we were running like that for about 2 years now, I want to say. So basically my role was more the business aspect of it. So I was basically taking on the reports, treatment planning the new patients, and then basically helping her anytime that I could, like by flipping her room or, perio charting for her or anything like that, where she would basically take the bulk of the schedule and she would see most of the patients that were in the schedule. There was a same day start. Obviously, I would jump in and help with that, take any overflow patients that would come in. But for the most part, her job was just taking the patients that were already in the built schedule.
Okay. So do you make your own treatment plan?
Well, basically, we do. The doctor obviously has to approve it because they're the doctor. You can't diagnose and all of that. But we are the ones that are perio charting. We're the ones, recommending the treatment and, running it by him. And obviously, he has to be the one or she writing off on that.
Okay. How many patients are you required to see a day? Do you have an amount that you have to see?
Typically not required to see. Of course, we want to, make the most of our days and be productive and see people, but there's not like the amount that you have to have in your office.
Okay. So how much time do you usually get for a patient?
Depending on the procedure and depending on case by case, you pretty much can make up your own time frame of who you want to see for how long. Generally, profies, right now for COVID, we like to at least have like an hour. That way you have perfect time that you can sterilize the room and everything like that. And then peri-maintenance is maybe an hour and a half, if it's somebody that's coming back and their home care hasn't been pretty good in the past. But sometimes you can get it done in an hour. And then for scalings, depending if you could do a full mouth, maybe 2 hours. If you're doing just half the mouth or a quadrant, hour and a half. Basically, it just depends on what that patient looks like and how long you think that you're going to need for them. If they come in, they have a lot of staining, obviously, they're going to need more time. If they have a lot more subgingival calculus, they're going to need more time. If somebody comes in, they're a prophy and, feel like you could just take the polishing up around the teeth, then you can use a little bit less time. So you kind of just gauge it yourself. Okay,
good. So how do you discuss the price of a procedure with a patient? How does that conversation go?
Well, I never used to be comfortable doing that until recently, as I got more experience in learning how to look at things myself. So at first, I typically didn't. I would wait for my office manager, the treatment plan coordinator to come in and discuss pricing. But I kind of just got the feel of it. I learned how to read things and how to figure it out myself. And basically I just say, hey, this is what it's going to cost. How do you feel about that? And either, yeah, they are okay with that, or no, I'm not okay with that. And then that's when I would step away and grab the office manager and they can come in and discuss other options for them that can benefit them.
Okay. So just some of my personal experience, what I loved about Aspen coming in was that I did have the freedom to be able to discuss that with my patients and to be able to treat my patients the way that they had been treated. In my experience, what I had found was that a lot of the places that I worked were under treating patients. And so patients come in with that preconceived notion that, oh, I'm just here for a prophy. That's what I've been doing for years and years and years. And so, you know, that always is a hard conversation sometimes to have when somebody's expecting that. But what I loved is that I was able to actually explain to the patient. And again, we're going to go over some of this, but some of the tools that we have at Aspen to actually show them their mouth and to explain to them why, you know, that we are recommending these treatments and that this is the standard of care. And unfortunately, you know, that there has been issues that have been going on, you know, so what kind of technologies do you have in order to show your patients what's going on in their mouths?
Right now we're using the iTero scanner, so the 3D scan. So typically you see that a lot with Invisalign, but you know what we mostly use it for is showing patient education. That way you can show them the different perspective of their mouth that they might not get to see by just looking in there themselves. We also use regular IO photos too still. So I can pull that out, and basically what I like to do with that is do like a before and after. Or if I'm only scaling half the mouth, I can show them like, this is what we just completed versus what still needs to be done. So it kind of opens their eyes there too. X-rays, any radiographs, you can pull them up on the screen in front of them because they have the TVs in every operatory, and show them like, here's where your bone level is. This is radiographic tartar that you can see there. Kind of explain it that way.
Okay, perfect. So who does the X-rays on the new patients? Is that your responsibility, or how does that work?
It is the dental assistants, but like I said, if they're slammed, because right now in my office, they are down an assistant, they're down a set of hands. Me or the other hygienist can step in and take the full mouth series and do it ourselves. So it helps free them up, and you know, we're happy to help whenever we can.
Perfect. Do you hire new graduates?
Yes, like I was a new graduate when I first started. So yeah.
Perfect. So I work a lot with schools and students, and one of their biggest things that they talk about all the time is going from dental hygiene school where they're seeing a patient for 3 or 4 hours for one patient to going to a schedule of patients, and that's very intimidating to them. So can you talk a little bit about how we do our, you know, new hires or new graduates that come into the offices and the training that they get?
So we do the hygiene orientation program. I know they rolled out some new training compared to what I was trained with. So typically it's like 2 weeks long. You are online doing modules. That way you kind of get a feel for it that way. And also you can shadow the hygienists that are currently working or that you're training with. And you can kind of see how the flow of things go. So I can say when I first started, I was very intimidated personally, very overwhelmed, especially because I started in an office where the hygienist I was trained with was having a baby. So I kind of I felt thrown in, very overwhelmed, but it wasn't like that at all. You know, I thought that it was going to be very, very crazy, but luckily I had enough training, and the hygienist that I trained with kind of walked me through everything. Like, don't freak out. It's okay. You know, it might feel a little bit nerve-wracking sometimes, but you'll catch the hang of it. And that's exactly what happened. I just never looked back after that.
Yeah. So when I first came into the office, I was a hygienist with 19 years of experience, and I thought I knew everything, and I didn't. And so what was nice is that I had that 2-week period where the girl that I worked with, she took me through and basically went through everything. I learned so much. I relearned actually how to be a hygienist, because you lose a lot of that sometimes in private practices that are, you know, you don't have the freedom to be able to treat patients the way they were. So I learned so much in that 2 weeks, and it was so nice to have that and to go in, because I was a little intimidated, believe it or not, being a hygienist for 19 years, you know, to actually say, hey, you have the freedom to treat your patients the way that you see fit. So that was refreshing and a little scary, but it was nice to have that 2 weeks prior, you know, to kind of ease me into that, even as a seasoned hygienist. So that's good. Okay, so let me see here. What is the new patient exam like, and how do you manage that between scheduled patients?
So basically, patient comes in, they have to fill out their paperwork and all that fun stuff. When we finally get to take them back, they have a pan taken in a full mouth series. Once that's all completed, they go into an operatory where we do a dental health scan, which is using the iTero, like I said before, for the patient education. Once that's done, typically the hygienist will go into the room and do the perio chart and explain treatment on their findings. And then after that, doctor comes in, takes a look at them, treatment plans the rest of their mouth, their teeth, and everything like that. And then once that's all done, they go to the office manager or the treatment plan coordinator, and then that's when they talk about financing and then get them scheduled. And then after that, if they want to start same day, we can undergo their treatment same day, and if not, then get them in as soon as we possibly can. And that's the part that I struggled with in the beginning, is finding my rhythm of when I can stop with my patient and then go see the new patient. Because I was in the beginning just a single hygiene office. It was just myself, and still being pretty new in the hygiene realm. You just have to find your group, but you do. Especially now with COVID and everything, things have changed a little bit. You used to be able to stop and break away from your patient, but now you kind of just want to finish what you're doing. That way you can take off your PPE and do things right, and then go in with the new patient to do that. But you'll find a stopping point, and then that way you can break away and go in to see the new patient.
Perfect. Okay, so one question was, does the doctor examine every patient?
So it's pretty much preference of the doctor. I've had a doctor that would like to see their patients every 6 months for their recalls. And then I've also had a doctor that I'm with right now, he prefers once a year unless they're having other issues, other problems. So it's really the preference of your doctor.
Okay, good. So here's a question that was posed. How do I become a lead in my office? How do I become a lead hygienist?
So basically how I did, I opened the office that I'm at. I've been here, the same office since I started. So basically it came out of seniority, I guess. I was there. I know how the office worked, but really just, doing everything that you possibly can do. And then you can, get into that spot.
Okay. Do I order my own supplies, or is that done for me?
You order your own supplies. There is, which can also seem very overwhelming, especially if you're not used to doing it, especially, if you were a new grad and you're really not used to it and you never had that job before. There are different reports that you can use to look at to help you, like, oh, okay, you have this many patients coming in that might need an electric toothbrush. So you can kind of gauge it a little bit on how many that you need to order. But it's a very simple system that we use. So it's really not that intimidating at all. After you at least use it like one time, you'll get the hang of it. Perfect.
What type of benefits do you offer?
Well, 401k, medical insurance, vision, standard, pretty much what you expect. As far as dental, again, it just depends on your owner. My owner, for instance, he, lets us, take care of what we need to take care of, and basically go from there.
Okay. Do you work Saturdays? Are the offices open Saturdays?
One Saturday a month, typically.
Okay. And that's generally depending on what the doctor would like to do, correct? Are the offices owned by the doctor?
All offices are different, but there are owners to offices. Yes, not every single office is owned by the same doctor. There is doctors that have multiple offices that they own. So I guess it really just depends on the area.
Good. Okay, so we're gonna, of course, go to COVID because that's something that's been in everybody's mind. So how has your patient appointment changed with COVID? What do you do differently now?
Extended times to give you the right amount of time to clean everything in between patients. We have been seeing less patients because of that, because you need more time. PPE, pretty much still the same other than the types of masks that we were using. I've personally have been incorporating face shield some days, if you're using the Cavitron and stuff, anything to make you safe. So that would probably be the only thing tire-wise that has changed a little bit for me. But for the most part, I've been doing the same thing since before, like you should be. As far as the appointments, it's just extended times. And like I said, stopping the breakaway, and when you're in the middle of a patient in your chair to go see a new, I've kind of stopped doing that and just waited till I was completely finished to stop.
Good. Okay, so do you have adequate PPE? How is that played out in the offices?
Yeah, so we do. They supply gowns, shoe coverings, hair coverings, the masks, the new masks. That comes in daily. I feel like, at least in my office, I feel like we get a shipment of something new every day. So yeah, we never have to worry about our PPE. They're definitely supplied.
Okay. So what other types of roles beyond chair side roles are available with Aspen?
Yeah, so you have, it keeps going up. So territory hygiene manager, who's also there to support you. So especially if you are new, and you have questions out of the training, you always reach out to them. And then they just there's other of levels basically. So the territory and then the director, and it just keeps going up from there. So there is a whole chain of people that are there to help you as far as if you have any questions about, how the office is ran.
Okay. So other than general cleanings, scalings, replanings, what other services are you required to do as a hygienist in the office?
We do oral cancer screens. We do Zoom whitening. Those are, two big ones, at least in my office, that we do. Do sealants and typically, that's pretty much it.
Good. Do you do laser treatment for perio?
I personally have never done it. I'm not aware if other offices do provide that, but where I have worked, I have not.
Okay. Let me see here. What do you have community outreach programs with Aspen Dental?
Yeah, kind of like what we're doing right now. I feel like if people have, questions, I like that we're doing this right now. That way that we can answer them for people. And basically, if you're looking for a job, we're always looking, especially people that want to move up in the company. There's always spots that, become available. So.
Okay. So talk about a little bit about the veterans that we do, the day of service for veterans.
Yeah, we do offer the day of service, typically one day, but in my office, at least, we always try to help anytime that we see a veteran coming in any way that we can. But the day of service, unfortunately, I haven't been able to participate in since I've been working. Always wanted to, but never got the chance to. But we bring veterans in, and then basically we take care of what they need taken care of, free of charge.
And how about the mobile mouth unit?
So again, something that I've always wanted to do that I haven't had a chance to do, but we have I don't know if you call it a truck or van, but they go around to different areas. And then basically it's like an operatory in this truck, and we can, help patients that way. That way they don't actually have to come into an office.
Good. And let me see here. I'm sorry, I lost my spot. Just excuse me for 1 second. I was in looking at this, and you had me enthralled with that. So, where was I here? Oh, do you have part-time hygienists?
We do have part-time hygienists, yes. It just depends on what is needed. There are hygienists that even float to cover certain areas. So they don't have one home office. They can go help where it's needed. So if a hygienist needs a day off, the float can go, step in, take care of that office for the day or however long they need to. But they do offer part-time to, work a couple days a week. They don't have to be a full-time.
Okay. And how many offices are there? How many offices does Aspen
I think
have?
I lost count.
I know. I think there's definitely over 800 now.
Yeah.
Okay. So if I have gone to school in Pennsylvania and I start at an Aspen Dental in Pennsylvania, can I transfer to an Aspen Dental in Florida?
As long as you have the right license, I don't see why you couldn't. Just make sure that you have that. Okay. And they have an opening.
Yeah. And as a patient, and this happened to me a few times, if I'm going to an Aspen Dental, I have had a couple patients who actually had homes in Florida. How do records transfer? How does that work? If the offices are independent, pretty much, but under the same Aspen umbrella, how do you transfer your records?
Records are all in the EPMS system. So basically, anybody can access them. They can transfer to any office. If you're in, for instance, in Ohio and you do want to go to Florida, if I stop into an Aspen Dental, they can pull up my account right there. X-rays, or you can transfer them and everything like that. So we did switch over from paper to paperless. So now everything is right there.
And what software system do we use? Do we use
EPMS? So it's kind of its own system. You have to learn how to use it.
Yeah. Okay. So a lot of people ask me, do you use Dentrix? Do you use EagleSoft? And so, I mean, honestly, I've used all of those. And I think that our system is pretty similar. Once that you learn it, it's pretty easy to navigate.
It's all about learning.
Yeah. Have we done any type of teledentistry during COVID?
Yes, we have.
Okay.
So patients call in or expressing their problems, where dentists can help them out, kind of diagnose it over the phone the best that they could. If they did have emergencies, I know some offices were actually open to seeing those patients, coming in for emergency services and helping them out that way. But I do know that they did have that.
Okay. Do we offer any type of CE?
Yes. So there is a whole slew of CDs. I actually took one today, but they do offer a whole slew of them. They could be interactive, not interactive, like on demand. So that way, at your convenience, but they do, and they're all free. So they do offer that.
Okay. And I think we were also offering that to even non-Aspen people during the COVID and the furloughs, that any dental professional could actually join or get free CEs from Aspen. So that was a nice thing to do. So let me see here. Let me get CEs. How about any type of training, like when you get something new in the office? How do they handle training you on that?
So our newest thing that I attended was the Invisalign. So that is something that is pretty recently rolled out in all the Aspens in the last few years. So basically what we did is got together, they break up each area into components, and have a session and get everybody together in one place and kind of go over the training. It was a couple of days for the Invisalign training. They broke everybody up into groups between doctors, hygienists, office managers, and they kind of went through like how it worked. So that was the experience that I had.
Okay. So do you have specialists at Aspen, or when do you refer out a patient for services?
So we do have specialists. The one that comes to our office is an oral surgeon. I know there is an endodontist, and I'm sure there's others at other Aspens, but the only one that we have coming to my office in particular is a surgeon. So we do also refer out to others that are non-Aspen. For example, like my surgeon, if there's a patient that comes in and needs a biopsy, he would rather not see that patient because he can't follow up with them within a good time frame. They typically, he comes to our office 1 to 2 times every month. So we refer out to the oral surgeons for that. Or if a patient needs something done immediately, and they, by the time our surgeon comes in and he's scheduled to come in, they can't wait that long, we'll do that as well. Any like root canals will refer out. Like I said, we don't have an endodontist that comes to our office, but we will refer out for that as well.
So I think we are having endodontists come in there, at least in our office. Before I left, they did have an endodontist coming once a month. So we do offer endo also in some offices. As far as perio, how do you determine if you're going to treat that patient in the office or refer them to a periodontist? Is there a time then you do that?
Typically my rule of thumb, if it's, I kind of just go with my gut. If I think that, and I feel confident that I can treat this patient and give them, the best quality of care, then I'm going to go ahead and treat them. But if a patient comes in and they present to me, it's like a 9mm pocket, I'll, refer out to a periodontist. it's basically how comfortable I feel and how confident I am that I'm doing the right thing for that patient.
Okay. So one question that we get all the time, and I always get this with students, is how do you handle negative press and preconceived judgments about Aspen Dental?
You always want to say something, right? Everybody always wants to say something, but the best thing is, just kind of hold back. You know what you're doing. You know you're doing the right thing, and you're doing the standard of care, and you're educating patients, and you're treating them how they should be treated. So a lot of times people get angry and they, express their feelings, and that's okay too. But just kind of ignoring it, as long as you know you're doing the right thing and you're being ethical, that's all there really is to it.
Right. And, I tell students when I talk to them, I always say that, you have to kind of look at the people who are complaining, and usually you'll understand. And most of the students, once you talk to them, or any hygienist for that matter, understands patients. So patients get angry when they hear something they don't want to hear. So when a patient comes in and has been told for 20 years that they only needed a cleaning, and we're seeing, signs of periodontal disease, they get upset. Obviously, our denture patients are always, a little more difficult because they're expecting a certain thing, and, dentures at their best are never perfect. So another thing that people ask, are we a denture mill? Do we do an excessive amount of dentures?
We do have a lot of cases of dentures, but we do have the in-house labs. We do offer that for them. But again, it all comes down, ethics. We're not going to recommend dentures, for somebody that doesn't need them. We try to save teeth when we can. But it does help that we do have that lab on site so people can get their plates faster, easier, better experience.
And I always tell people too, a lot of times our patient base is patients who haven't seen the dentist in a really long time. So when you look at that and say that the average patient has maybe been 10 years since they've been seen, you can't expect for that person to not have some sort of dental issues. So a lot of times patients are really not aware of their dental health, and they come in and, I've had multiple patients that have had to have full mouth extractions, and they're shocked. I mean, they have no idea. The nice thing, and what I loved about Aspen, was that we did have the tools, the intraoral cameras, the iTero scanning, scanner that can show a 3D picture, and a picture is worth 1,000 words. And when you show that patient exactly what's going on in the mouth, it's hard for them to not be able to understand. I can talk, I can show x-rays, which a lot of times patients don't always understand, but when you show them those pictures and the iTero 3D scan, it's kind of hard for them to not see what's going on. So that's wonderful that we do that. So talk a little bit about, this is kind of an internal question, and for people that only work at Aspen would know this. So we have our own intranet, which is the Bridge, and how does that tool help you throughout the day? What is the Bridge, and what does that do for you throughout the day?
The Bridge is the keeper of all the information. So whether it being, because we have forms that we give our patients, at least hygiene patients, notifying them of their gum health. So that page there has, and I'm a hygienist, and that alone has all the resources that you need. Education tools on there as well. It provides all of that on there. Consent forms that you may need, it's all on there. The Internet, the Bridge, it's basically your go-to for everything. That's where the requisition system is. That's where you find your CEs. That's where your courses are that you need to take, just to keep you updated with everything. But yeah, it's the keeper of everything.
And one of my favorite parts about the Bridge was the forum that you can ask questions to hygienists all over the country. A lot of times in private practice, you feel like you're on a little island. You're the only hygienist in the office, and you have a question. You may have some hygiene friends out there in Facebook land, but you don't really have that backing and that support. So with the Bridge, you can get on, and I mean, multiple times I've gotten on the forum and asked questions. Hey, what's the code for this? Or how do you treat a patient this way, or, how do you order this, or, what are we doing here? And it was just nice to be able to know that there was a whole world that, even though it's very large, seemed very small and personal and family. So that part of the bridge was amazing, on top of, like you said, all of our CEs on there and all of that good stuff.
You never have to worry. If you're having an issue, there's probably somebody that's already came across the same thing and they have the answer for you.
Exactly. And, as far as being a DSO, people say corporate, it sounds so cold, but really it's about support. The S in the DSO, to me, was the most important. And it's really about support. So you have a whole network of support in our territory hygiene managers, our division directors, our vice presidents of hygiene. We have so much backing on our hygiene that it's amazing to me. And also, part of being a DSO is having that support for the offices, so that you and the dentist can do their jobs and treat patients the way they need to be treated. That whole, we take care of the recruiting and the marketing and all of that stuff. And that's something that, the dentist doesn't have to do. Do we do implants in our offices?
Yes. Can't speak for all the offices, but I know my office does. We do them pretty frequently, actually.
And how is that? How is your appointment? Do you do implant maintenance, and how does that appointment go?
Yeah. Basically, bring them in just like you would any other patient, whether they have implants or whether they don't. You want to check if they're just implants, then deal with that. But if they do have teeth, do just like any other appointment. Chart all the teeth, clean everything up, polish, floss, fluoride, and that's basically it. Same routine, just adding some implants in there.
Okay. So going back to, I know you mentioned the hygiene orientation program. Can you talk a little bit more about what that 2 weeks looks like, and what exactly is discussed and gone over at that?
Yeah, basically, like I said, there's modules that, you have to go through, whether it be how to use the rec to order supplies, whether that how to use some of the reports, and as far as, just sterilization, how to do things right, ethics, all of these different modules that are going to help you, even if it's like a refresher. If you're a seasoned hygienist, it's just a refresher course on how things are. But again, you shadow whoever your trainer is. They can kind of guide you and show you, like, this is how we do things. This is our flow here. Typically, this is how it's ran, and kind of go through it that way. And then once, you're following the trainer, you can step in and take on yourself. And then that way you still have your trainer there to help guide you through everything and help you, and chart with you to make sure that you're not alone and you feel like that. That way you can ask questions while they're there. And then once that 2 weeks is up, they're still going to be your trainer. You can still reach out to them. You have a colleague now that can help you with any questions that you may have, and you just keep moving forward.
Good. So part of HOP, the hygiene orientation program, is basically about the why we do what we do, why we recommend the products that we recommend, and talk a little bit about what metrics. I mean, we know metrics, but some people don't, and that kind of scares some people. To me, I love the metrics. That for me was a guide to kind of keep me in line and say, okay, I'm doing what's right by the patient. I know that this amount of patients came in, and so I use that as that guide. So explain a little bit about what metrics are and what that does for us.
So when people hear metrics, they think of the numbers, and that's, it is numbers. Yeah. But like you already said, it's kind of like your driving point, and you can kind of range and see, yeah, I'm doing the right thing, or no, I might need to change some things up. Your numbers follow your actions. So basically it allows you to see, during the month, how much you have produced, how much product you've given out to patients, and procedures that you've done. And, and like you already said, like, it drives, it basically is a guide to show you, like, what you've accomplished during the month, and maybe, hey, what can I do better, and what can I work on with patients, and how can I better educate them?
Perfect. So for me, Aspen really enlightened me on dental hygiene. I kind of lost my luster for it over the years. I felt like I wasn't being utilized in what I needed to be. I was just basically prophy, and that was my job. So it was such a refreshing thing for me to come to Aspen and see the patient education and care that we give. So how do you, what type of education, what do you tell your patients whenever you're explaining to them that someone who came in that may have only ever had cleanings and that's what they're expecting? How do you have that conversation with them to explain to them that they do have, gum disease, they have pocketing? What's the verbiage that you use?
So basically, you get that all the time. My previous dentist never told me about that.
Right.
Well, they might not have, but this is what I'm seeing now. I don't know what your condition and how your oral health was back when you saw your previous dentist, but this is what I'm seeing now, and this needs to be addressed. This needs to be treated, and kind of go at it that way, because it is kind of an awkward situation where you're like, oh, especially like when the patient was seen maybe a couple months ago, like 6 months ago, and they thought they were completely healthy, and maybe they were, but you don't know what their state looked like months ago. You just know what they're looking like right now, and you can't, vouch for other doctors, other hygienists, and their treatment recommendations. You can just, stand for your own.
Right. And so, again, a lot of times, we're now finding out, and again, we go through these training. So I know when I was in office, we did the new guidelines for the periodontal staging and grading. That's something that Aspen, provided for me to be able to learn that new technology. So, and what we're finding now is that a lot of health problems are being related to periodontal disease, and more, it's about prevention. And so Aspen, to me, does the right thing. That's what should be done. So, sum up your experience at Aspen and what it's meant to you as far as a hygienist and how you've grown.
I guess I kind of only have Aspen to look at as job references, but I've worked with people and hygienists that have came in from private practice offices, and I hear that they don't offer comprehensive care. And I think that's what kind of makes me appreciate Aspen so much, is because that's what we do. And people might not like that all the time. They might come in and, hey, I only have this one problem, address it, and that's fine. But the fact that I know that I've educated my patients on, hey, this is what's happening, and this is what I'm seeing, that just makes me appreciate it, a ton. So that's my, biggest takeaway, I guess, from the whole 4 years that I worked here, is just knowing that I'm benefiting people and knowing that I'm doing everything that I can to help them.
Great. Well, I always love to talk to a fellow hygienist, especially an Aspen hygienist. I feel like my career has grown so much, and I think that there's a lot that Aspen offers for our hygienists. So I appreciate your time. I thank you for answering all my questions. And anything else that you would like to say?
No, I'm good.
You got it all in.
Hope I can help.
Yes, thank you, Chelsea. I appreciate it. And you have a great night, okay? Thank you, everybody, for joining. Have a good night.